think some people are surprised that an older female vaping.
For more than 40 years, Diane Gorman smoked a packet of cigarettes a day.
I've always loved smoking. You can put as many health warnings on a cigarette pack as you want. It will make no difference. I enjoyed the sensation of smoking. I was addicted, basically.
She was so addicted, she couldn't stop, even when she wanted to.
At one stage I got down to 5 a day, and my poor husband, he could not do anything right. He was very glad when I gave up on trying to cut down cigarettes. I could not go up to the letterbox without carrying a packet of cigarettes with me in case I met a neighbour and we got stuck up there talking and I didn't have cigarettes on me.
But a few years ago, something happened that changed her life.
I had my first vape and I haven't smoked since that moment. It was instantaneous, no cravings, no regrets, no nothing. So all I have to do is measure out 3 millilitres of my nicotine.
Diane's doctor is supportive of her vaping, even writing the 70-year-old a script for nicotine.
Having a doctor who knows about vaping is a great advantage.
If somebody is coming in to ask about vaping and they are wanting to use nicotine, then we as their doctors are able to write them a prescription to obtain nicotine. See? Show it in. See?
Brad Mackay is not Diane's doctor, but he is one of the GPs who believe vaping is a better alternative to cigarettes.
So how have you been going with vaping these days? Is vaping the new methadone? I suppose at this point of time, it's a similarity. I would support somebody vaping if they had tried everything else to quit cigarettes. Then yeah, I would consider offering vaping as another solution for them.
What evidence is there for their safety? There's no evidence there. Someone who's prescribing it has no idea what these liquids got into it. If someone dies tomorrow morning, who's responsible for it?
At the University of Tasmania, Dr Sukhwinder Sol has compared the effects of cigarettes and vaping on human cells.
We compared vaping with traditional tobacco cigarettes, and what we found in that is that actually these vaping or e-cigarettes is actually equally toxic when we compared it to the traditional tobacco cigarettes. So when we stimulate the cells with these new gadgets, they switch on to produce these cancer-related proteins. So that's a big signal there that we should not be promoting these as a safer alternatives.
In the United States, vaping has been linked to at least 18 deaths and more than 1,000 cases of lung illness. Yet despite this, some doctors believe the risk of vaping is lower compared to cigarettes.
Vaping's been around for about 10 years and we haven't seen the same effects that smoking would have. So I'd say if you're smoking or vaping, I would prefer that my patients would be vaping. If it was fresh air and vaping, fresh air is your winner.
But with an estimated 300,000 Australians now vaping, and that number growing, he'd like to see greater regulation of vape products.
The chemicals that are in the e-liquid for vaping, some of them have been linked to cancer, but again, it really depends on where you're getting the solution from. But at the moment, it's like the Wild West. You have no idea what you're getting.
People can unfortunately get a whole range of products, most of which they probably don't know what is all the ingredients and the constituents, and they're breathing those in under the extreme misapprehension that they're actually doing something that's not potentially harmful and not good. So it's much safer from a medical point of view and a public health point of view if we just say no vaping whatsoever.
AMA Vice President Dr Chris Sapala is concerned about the growing number of Australians vaping.
We've seen a significant increase in recent months of vaping-related illnesses, patients who unfortunately are becoming so unwell that they're ending up in intensive care, and as I'm sure people are aware, there have been some deaths related to vaping. So there's no question that there is a toxic effect from the fumes, the vapour itself.
He wants doctors who are prescribing vaping to think carefully about the consequences.
This notion that you can just replace cigarettes with vaping and go on is clearly a flawed one, and we need to push back against that.
GPs who are in favour of vaping argue the laws need to be clearer.
Every state has a different law, every territory is different, and this creates a lot of confusion for the consumer. Even doctors are trying to keep up with what's going on with the legalities.
But for Diane Gorman, the options are clear.
I'd be smoking if I wasn't vaping. It's as simple as that.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.